Hello guys. The next very important concept for D pharmacy student is sir, what to write in the examination, how to write. Many students asked me this question, sir, what to write to get these good marks and what we have to write, what content should be there in our answer sheet. Very simple answer for this. See, first you read the question what they are asking. For an example, write the structure and use of choramine, sulfadiazine, mannitol, and glutathione. Very simple. They have asked here, see, structure they have asked and they have asked uses. First you write what is this choramine. Okay, means it is used to prevent the overdose of the tranquilizer. Then you go for the structure. You plot a structure. You are observing here the structure of this choramine means amine is there. See here nitrogen bond is there, no, so that's why they are known as amine group, choramine. Then you write 2 to 3 uses are enough. Next sulfa diazine, this is the structure of the sulfadiazine uses. Next mannitol, structure of the mannitol uses. Then glutathione, this is the structure and the uses. This simple technique you have to follow in 4 marks as well as in 13 marks. See, one point I am going to tell you how to write the 13 marks questions. Later I will tell in this video only. First 4 marks you give concentration. See, 4 marks basically what they will do, they will ask the 4 structures and 4 uses in pharmaceutical chemistry. Like write a structure and uses of mannitol, structure and uses of sulfa thiazine, okay, sulfadiazine, mannitol. Simple question they will ask in 4 marks. You have to write a structure and 2 uses. It's enough for 4 marks. Okay, then one more question here. See, write the structure and uses of chloroquine, propanolol, procaine, and pyrazinamide. Very simple. Procaine, pyrazinamide. Very simple. Procaine, see, this is structure. It is used for the dementia patients. Means what is this dementia patient? Means basically these are used to treat the central nervous system disorders. Okay, dementia means those patients which are suffering from these brain disorders, used to treat depression, high bp. This is the procaine. This you have to write. Next, see, structure and uses. Most probably in 4 marks they will ask the structure and uses in pharmaceutical chemistry. You go through that. Clear? Next, if we discuss on the 13 marks questions, what to write in 13 marks. One more. See, in 4 marks define and classify vitamins. If they ask means what you have to do, first you write these vitamins, what are these vitamins, then you give example, then you give functions. Don't directly go for classifications, you give functions. After writing functions you write 2 to 3 functions, then you go for classifications. Means water soluble, fat soluble, water soluble, which types of water solubles are there, means 8 B vitamin, then vitamin C. Then for fat soluble is A, D, E and K. These are the fat solubles. Next, classify antiseptics and disinfectant with example same. You have to write the antiseptic, then classification of antiseptic, then disinfectant, classification of disinfectant. Very simple, very simple. This technique you have to follow where in pharmaceutical chemistry. Not only in pharmaceutical chemistry, in any subject like pharmaceutical jurisprudence, there directly they will ask the note. Write a note on drug and cosmetic act, you have to write that. Then you have to write the characteristics of the drug cosmetic act. These basic and simple things if you follow means really you will get good marks in your examination. Then one more example I will take you, the subject that is of the hospital and clinical pharmacy. Now look here. Yes, now see, this is the hospital and clinical pharmacy. What you have to write here, write a short notes on central sterile supply services. First you have to write what is this definition, means central sterile supply service, then some of the importance, then activities of the CSSD, cleaning, disinfectant, sterilization, supply of sterile materials. Simple. Then write a brief note upon bedside pharmacy. Very simple. Bedside pharmacy, you write that. Then role of pharmacy act, means bedside pharmacy act, role of pharmacist act, bedside pharmacy, you write that. 4 to 5 points, it's enough. See, one more point I am telling here, in 13 marks what they will do means just they will pick a question from 4 marks and they will add in the 13 marks. Simple. There is no a single questions in 13 marks. For an example, write a note on outpatient. No, they will give minimum 2 questions, maximum 3 questions in 13 marks. Define outpatient, explain different stages of outpatient. This is one. In A they will give. Then in B they will give write a brief about bedside pharmacy in B. Like this way they will ask 2 to 3 branched questions in the 13 marks, but in 4 marks only one question. Write a note on bedside pharmacy, write a note on outside patient. Simple. Write a note on CSSD. Very simple. This type direct questions they will ask in 4 marks, but the branched question or the substituent question they will ask in the 13 or 14 marks in your part B. Simple. No need to worry. Just to practice what questions I have supplied for you. Means for the hospital and clinical pharmacy, pharmaceutical jurisprudence, pharmaceutical chemistry 2. Okay, DSBM questions also I have framed. Soon I will give a questions on the pharmaceutics. You don't worry about that. Many subscribers are asking me, sir, give the questions. Due to your postponement of examination, I will give you pharmaceutics questions. If possible, I will give answers for those questions if possible, but I will give the questions for the pharmaceutics. That you don't worry, and you practice only these questions and answer what I am giving. No, you practice these, that is enough for your examination. Okay, that is enough for your examination. So if you are new to this channel, subscribe our channel Legend Pharmacy. You will get this type of information. And one more, our backup channel Medico Shorts. There you will get some of the important information about a drug, means what the uses of that drug, side effects. And this channel is very useful for the D pharmacy second year, because they require 3 to 4 months of the internship, means training. For them this channel is very important, because there I am giving a drug information, uses of that drug, some of the severe side effect of that drug, and dose of that drug. So first you subscribe that channel Medico Shorts. Thank you.